My name is Michael Betel. I'm the president and founder of the Fatty Liver Alliance. Our work is all about building a better future for patients with NAFLD and NASH. What we're going to do today is talk a little bit about who the Fatty Liver Alliance is, what we do day to day, and the types of activities that we do, a little bit about NASH in 2023 and where we're at, and some take-home messages. We focus on four key pillars. The first one, which is really important, is talking about the liver in general. Almost nobody talks about the liver. We'll talk about that later on as well. But we need to raise awareness about NAFLD and NASH in general because it is so impactful in all of our communities. We focus on education because we need people to be aware of risk factors, that they need to be assessed for NAFLD and NASH, that they need to control the types of foods that they're eating, and that there are some treatments even available now that they could use. And we'll talk about that as well today. And research focus is important so that we can share young investigators, new research that's being done and published, and we do that all the time. And we want to focus on advocacy so we can make changes and be that patient advocate voice. And so we're going to talk a little bit about that as well today. We are committed to one of really over 100 different types of conditions of the liver, and NAFLD and NASH is just one of them. And globally, there are not a lot of organizations that focus just on NAFLD and NASH, and in Canada, where I am, we are the only ones. And it's really important to be able to share information about the specific liver disease, and that it is a multidisciplinary approach that's need to be taken, and we're going to talk about that as well. So this is really an important slide. We think about the patient-centric way that we usually look at medications and treatments. And in this case, it's not just about the patient and their primary care physician. It's also about the gastroenterologist and hepatologist, of course, because, these are liver conditions. But now, more recently, other areas are becoming involved, like the endocrinologist, because of type 2 diabetes, because of obesity and insulin control. Cardiologists are being involved because there's interrelationships with the heart, the brain, nephrologists with the kidney, even dermatologists with skin conditions where patients are presenting. My daughter, as an example of another specialist involvement, had bariatric surgery to reduce her body weight and eliminate her NASH, which, by the way, worked, but she ended up having her gallbladder out and other issues related to that too. So not all of them are simple solutions, but the key point here is that it is now definitely a multidisciplinary approach that's needed. I want to talk about 5 key messages that we have for physicians that we want to share today. The first one is about NAFLD in general, that it is a very common disease, and because we haven't tested everybody, they're all estimates, but between 25 and 40% of us have fatty liver disease, and about 10% of those people are going to progress to NASH. And as we learn more, I think those rates are actually starting to go up a bit, especially post-pandemic, COVID-19, where people weren't having an active lifestyle as much and weren't watching the foods they were eating. And in some cases, drinking more alcohol, it did impact the liver, and it did impact fatty liver disease in general. So patients that have type 2 diabetes and obesity are at greatest risk. And you can see by the graph below here that the incidence is increasing and expected, if you look at the projections of 2040, to go even as high as almost 56%. So we'll see what happens over time, but it is definitely a condition and conditions that are not going away. The second point is that NAFLD can lead to cirrhosis. A lot of people still believe that NAFLD, or fatty liver disease, is benign and it'll go away on its own, most likely. And for some patients, that's true. But for some patients, you can see that it can progress from normal to fatty liver to NASH to F2, F3, cirrhosis when we get to F4, hepatocellular carcinoma. Some patients are going to need a transplant and even die from NASH. Now, one of the things that we can do is intervene by doing early assessments. And some of the ways that we can do that are through non-invasive testing. It doesn't always have to be invasive with biopsy. And I have a slide about that a little bit later as well. These are different approaches that can be taken right now and that are being recommended by physicians, and in fact, prescribed even by physicians. And those are exercise, The ASLD guidance statements say about 150 minutes a week, watching what we're eating so that we can control things like sugar and fructose. Weight loss is a part of that. Recommendation 7 to 10% really to make a difference in fatty liver. Some physicians are recommending vitamin E as an example. So I would suggest that that's a discussion between the patient and the physician. And as I mentioned before too, bariatric surgery is much more invasive, but it is also an option for some patients. The important note here is that there are things to do even today before medications for NASH have been approved. But sometimes medications are needed. Now, these are some of the medications available now. Metformin is one example to control cholesterol and fatty liver. GLP-1s to control weight are also being used for weight loss reduction and to control glucose levels and insulin. And there are hundreds, maybe thousands of studies that are going on right now in the fatty liver NASH space. There are 2 drugs that we are hopeful will get approval in 2023, and that's resmetirom and obeticholic acid. And we are looking at the data as it comes out, and the FDA is going through the process of approving, hopefully, those drugs soon. Now, one of the points that came up at the DDW this last week, and why we're sharing this right here, this is Dr. Mazen Noureddin talking about liver biopsy, and did a presentation that said, is liver biopsy dead? And that's because, and we did some research at the Digestive Disease Week 2023, 90% of physicians that we talked to and we surveyed said that they believed that non-invasive testing was a good alternative to biopsies outside of clinical trials. And so this was a very important topic because it is less invasive to do non-invasive testing and less expensive and also more timely. So resource-wise, it's a better option. Okay, as we look now at things that we want to propose for solutions, we're looking at 2 main areas here. One is about medical education and research, and that's with all physicians. So that includes primary care, also nurse practitioners, the endocrinologist that we shared before as part of that multidisciplinary approach, and also to support ongoing research so we can continue to learn and grow. The second part is, of course, the patient education so that patients are aware of their own conditions, can go to start with either primary care physician or endocrinologist and say, hey, I have these risk factors. I want to be assessed for liver disease. And so these are 2 areas that are key focus areas. Now, in the real world, we need to make change. And so this is where patient advocacy comes in. This is an example that happened in April 2023 in Ottawa on Parliament Hill. So it's like Washington in Canada. And we met with, this is under the guidance of the Canadian Association of Study Liver Disease. A group of us went down and met with members of Parliament and senators. And not only did we meet them and talk with them about liver disease, but some of them, like Richard Martel here, who's an MP, volunteered, and they were showing their leadership by getting their own livers assessed. And surprisingly, pretty much all of the people that we spoke with on Parliament Hill said that they have never raised the issue of liver disease before. So this is new for them and important for us to be there to start to talk about. Now, the other point I wanted to raise here is that we do advocacy with groups like ICER. This is the Institute for Clinical and Economic Review, April 28th, 2023, and the FDA, May 19th, 2023. And this is part of an FDA advisory committee meeting, and they are listening to patients and patient advocates to share their perspectives, as well as looking at the clinical data so that we can consider patients and their families. Hot topic now is about nomenclature and what these diseases are going to be called. So this is from a recent presentation. Dr. Marie Ranella and others shared this. This is about nomenclature. We've always used the terms, or for decades, NAFLD, non-alcoholic fatty liver disease, and NASH, non-alcoholic steatohepatitis. And this is now going to be changing to steatotic liver disease. So this is not official yet, but this is the direction that it's going in. And you can see the subcategories of fatty liver disease, or now the subcategories of steatotic liver disease, and how it's going to be more aligned with care for patients who have different needs. And you can see on the bottom part of the slide that there was 264 people, including myself, who are included in this Delphi process over years to be able to give feedback. So at the end of the day, not everybody agrees, but this is the direction that it's going in, giving you a heads up here now. This disease is really incredibly relying on relationships and alliances. And so physicians, general practitioners, hepatologists, gastros, researchers, pharmacists, even patients, their families, their friends, when we're looking at associations like the Fatty Liver Alliance or other not-for-profits, medical associations, governments, schools, education for children, industry, the food industry, the pharmaceutical industry, the biotesting industry, when you're looking at liver scans, so that diagnostic part of the industry, all of these should be working together to try to help patients and identify disease earlier and raise awareness. So this is about increasing the awareness and the momentum about liver disease and awareness. It's about spreading the prevention messaging, early diagnosis, when possible, early intervention and treatment, and of course, research when we can. So here's some examples of what's happening right now with us in the field too. On June 7th, we have an event that is about NASH and disciplinary care. And this is specifically with a hepatologist, and it's with primary care and endocrinologists working together to address fatty liver disease in their community. And this one is in Montreal. Here's another one in Ottawa that we're doing with Dr. Angela Chung. She's a hepatologist in the community. These patients in Ottawa have asked for this type of education, and that's what we're going to be doing here as well. Regularly, we have fireside chats with specialists across the world. These are international, and sharing current research and philosophies and ideas about treatment in NAFLD and NASH. Primary care is a key focus area, and because they're the first line, in 2022, we did the first annual event for primary care physicians on NAFLD and NASH. We had over 140 registrants, 17 speakers. We're going to do even better this year in December 7th, 2023, and this is an online event that you can register for. That's fattyliver.ca if you want, and it's going to be directed at benefiting primary care physicians. So this is really exciting, and we have international speakers going to be participating there. For 2023, I'm actually leading the Liver Action Network, which is under the guidance of the Global Liver Institute. There are all of these organizations that are what you would call grassroots, all working together, aligning messaging about liver disease so that we can make a bigger impact. And these are really great organizations to look into in different parts of Canada and the US. So what we want to get out of this is improved education and resources for physicians and nurses. We want to be able to increase awareness and understanding of NAFLD and NASH, and we want to be able to advance where possible the field of NAFLD and NASH through awareness and education, that early assessment, early diagnosis, early treatment, and making sure that we don't let the diseases progress. What's next for us? Increasing awareness, because it's never enough, understanding NAFLD and NASH. There are guidance statements that are out. The ACE guidelines are out now. So is the AASLD guidance statement. So we need to really make sure that people adopt these or are aware of them and can make a choice. We want to enhance the guidance and support for NAFLD and NASH patients. We want to develop and implement all of that, as we talked about, multidisciplinary care, and continue to advocate so that we can make change in this area. And this is something that we need to do together. And I want to thank you on behalf of the Fatty Liver Alliance. Thank you so much for listening.